Good day, it's Patricia Pisano from APT Injection Training, and we're just going to inject a glabellar complex today. So when we're injecting the glabellar complex, you want to be injecting the procerus muscle and the medial corrugators and lateral corrugators. To locate the procerus muscle, scrunch your nose up like a bunny. Okay? The procerus muscle runs longitudinally, and the fibers run vertically, and the lines show up as transverse lines across their nose. So again, scrunch up your nose like a bunny. So her procerus is here, her lines show up here. The oblique lines here are her nasalis. Relax. The corrugators lie horizontally, and they create vertical lines. There's a medial head and a lateral tail. Frown hard. Frown, be mad. Okay. Here's her medial head. Here's her medial head. Here's her recruitment, and just superior to the recruitment is the tail of the muscle. Her tail actually lies like this, and her tail lies like this. Okay. So when I inject her procerus, I'm going to clean. You can relax. I'm going to clean her with chlorhexidine. And when I inject the procerus, scrunch your nose up like a bunny. Okay, I'm grabbing her across the bridge of the nose. Relax. I rest my finger on the end of her nose, and I'm coming in between my fingers, injecting halfway with the needle. The barrel is level. In this particular case, I'm doing 2 injection sites because she has a very active procerus muscle. Frown hard for me. To locate the medial corrugator, I'm tucking my thumb into the orbital rim. I grab the bulk of the muscle. Relax. I'm resting my finger on the end of her nose, and I'm going to come just in between my fingers, barrel level. I bury the needle down to the hub, and I'm injecting into the medial head. On this side, frown as hard as you can. I again tuck my thumb into the orbital rim. I grab the bulk of the muscle. Relax. In this case, I'm grabbing a little bit more medially with my fingers so I don't block my injection site. And now I'm going to come in between with my needle, bury it down to the hub, and I deliver the rest of the product. To do the lateral tails, I'm going to hold my needle now between my thumb and my middle finger, and I'm going to push with my forefinger. So I wear a glove on the hand that's touching the patient, but no glove on the hand that's manipulating the needle, because I want to be able to feel the plunger. So frown hard. I tuck my finger into where the recruitment is. You can see very clearly here her lateral corrugator. I landmark, relax. I slide in, and I'm following the belly of the muscle. My syringe is at a 45-degree angle to the skin because the corrugator is superficial laterally and goes deep medially. So I want to be following along the belly of the muscle. And now I'm going to give her her dose. Okay. On this side, frown hard. I tuck my finger into the recruitment. I turn my hand all the way around. I landmark above. Relax, relax, relax. Okay. And again, I'm sliding along the belly of the muscle. In her case, the belly of the muscle, relax your head back, is lying in this orientation. But sometimes people are really flat and their orientation lies like this. Sometimes they have a very vertical orientation. So you really need to be looking for the anatomy, but the trick is to recognize that the tail is very superficial, the head lies deep, the angle I want at 45 degrees to the skin. And the reason that I don't grab the corrugators and inject in this area is because the frontalis lays on top of the corrugator, and everything interdigitates with the avicularis oculi that goes around the eye. And if I grab her like this, now I don't know whether or not I have corrugator, do I have frontalis, do I have fibers of the avicularis? So laterally, when I do that lateral corrugator, I'm trying as much as possible to not disturb the anatomy and make sure that I'm into the correct muscle.